I had brought this to my employer at the time, and my employer had said, I said, we need pelvic health and we should have this. And the response I received was, we don't need it. That was the response I received. One shouldn't have pain with intercourse. It is not normal. Intercourse is supposed to be a pleasurable experience. Through exercise as well, it will then also promote circulation and the cascade of hormonal events that will happen through the exercise. It will promote removing or keeping the hormonal levels balanced.
Today we're talking about the pelvic floor, not as something separate from the rest of the body, but as a system deeply connected to how we breathe, move, feel, and experience intimacy. In this episode, I'm joined by pelvic health physiotherapist Jennifer Nwankwo, CEO and co-founder of Nouveau Physio and co-founder of Elle Santé, for a grounded, myth-busting conversation on women's pelvic health across the lifespan. We explore anatomy, breath, and pressure mechanics, incontinence, painful sex, hormonal tissue changes, vaginal pH, and the nervous system. Jennifer also shares what she's building next, Elle Santé, a women's health platform and pelvic health app designed to support women between appointments. This episode is practical, embodied, and deeply informative. Let's dive in. Hello. I am so excited for this conversation. I'm sitting with Jennifer Nwankwo. She is a pelvic health physiotherapist for women specifically. I'm so excited to talk to her today. Hello, Jen.
Hello. Hi, Nat. Thanks for having me. I'm so excited.
I want to dive right in. I want to dive into your background. What brought you into the niche of pelvic floor health for women?
The awareness came when I had children, essentially. So I was a physiotherapist prior to specializing in pelvic health. And honestly, wasn't even on my radar, to be honest. It's a funny thing to say, given where it is that what I specialize in now, and the fact that I've been a physiotherapist for half of my career was physiotherapy prior to going into pelvic health. But I wasn't going in. I started in orthopedics. And so it was really when I had kids and I just became super aware of the changes in my body and what it was doing to my core, my pelvic floor. And then I became more aware, like more sensitive to the experiences of other women and the impact that they had with, or the impact of what pelvic health is in their lives, right? So you're just not aware of something until you're in it. That awareness with pelvic health was where, when I wasn't pregnant, it wasn't on my radar. I wasn't trying to conceive or anything like that. All of a sudden, when I did want to conceive, then that's where, I can spot women all over the place. Oh, she's pregnant. And then with that came with, this is what I'm experiencing, right? In their bodies. And then when I became pregnant, it was like, hope. And then when I gave birth, it was like, hope, right? So that's what got me into, like, in a more of an organic way through my own, I guess, awareness and journey in conceiving. Yeah.
Yeah. So when you actually conceived, so while you were pregnant, you were feeling your pelvic floor. And then when you conceived, You're like, this is exactly where I need to concentrate my time.
Exactly that. And I'd seen pregnant women pregnant or just women's health, pelvic floor, prior to specializing in this. And I didn't know what to do. It was very much, especially exactly. And it just didn't feel right. I was like, but I should know I shouldn't feel this way when seeing women who are, say, pregnant. Is it safe? Can I do this? And when I was working, where I was working at the time, I had brought this to my employer at the time, and my employer had said, I said, we need pelvic health and we should have this. And the response I received was, we don't need it. That was the response I received. So that was actually the defining moment in me saying, oh, no, that's not, the zeal for going to work after that was not the same. And I had weaned myself. That's when I started to build my practice from that moment. So thank you to that previous employer for saying that to me, because it really hit me like a lightning bolt at that point.
Yeah, I think the majority of the population has no idea what a pelvic floor is. So thank you so much for opening up a clinic that specializes in it for women and taking care of it. I think for my listeners, just to ground us in the anatomy of what we're actually talking about, because I do believe so many women don't even know about their pelvic floor. Can we talk about the basic anatomy of the vulva, the pelvic floor, the hammock?
Yes, yes. The vulva, in terms of anatomically, it is the most, it's superficial. The external parts to the muscles are deep. The pelvic floor itself, you can't see it, but the vulva, you can. So the first thing that you're going to see when looking, if you're to take a mirror and just glance at your body there, you're going to see the labia. So these lips that come together, that's part of the vulva system. That's what protects anything from the inside of anything that is internal. We're talking about vagina or the rectum or the bladder itself, right? So the vulva basically is the barrier between the external environment and the internal part of the body. So it's purely structural, the vulva, right? It doesn't have a function. It's more of a protective role as far as the vulva is concerned. So the labia is part of that. The mons pubis, so where the hair is, the very front, that's part of the vulva. And just really what you're seeing at the surface, that's the vulva. Yeah.
And so the pelvic floor, to describe it anatomically, how is it structured? Like,
I wish I had my model. Okay. All right. No, if we're going skin deep, okay, so skin is the vulva. And if we were to move the vulva, the first structure you're going to see is what is referred to as the perineum. And the perineum is the most superficial layer of the pelvic floor because it's multiple. It's not just one, there's multiple layers to it. But the perineum is the area that will overlie the urinary system and the reproductive system. Because what will run through the perineum is the first hole, which is to the front of the body, which is where urine will exit. So that's what we refer to as the urinary meatus, if we're talking about terminology here. And the one in the middle and back of that is the vaginal orifice, right? So this is the exit point for the vaginal canal. So in the perineum, you're going to find two holes, okay? If we move deeper to that, and in that perineum, you'll have two layers to it, okay? And it looks like a triangle. And it's pretty flat in its appearance, okay? It's three-dimensionally, it's a diaphragm, right? It looks like a diaphragm and it's flat and it's triangular shaped. When you move deeper to that, so you're getting closer to the organs, right? You're going to have a layer that's referred to as the levator ani. And this is the group of muscles that is shaped like a hammock. That hammock layer represents the deeper layer of the pelvic floor. And it's really shaped like a hammock. And that one will span the entire bottom of a woman's body, going from the pubic symphysis, the bony area of the pelvis, so the bony pelvis, and go all the way to the tailbone at the back. Unlike the perineum that I talked about, that is more closer to the skin, which has two holes running through it, we've got the levator ani, which is responsible, that has the rectum that's part of it. So you have the third hole. That's a component of that hammock structure as well, okay? And so this ensemble of layers of muscle together with the deeper hammock and the external flatter surface that's shaped like a triangle, together, this is what the pelvic floor is. And its primary role is to support the organs that reside within the pelvic cavity. Okay, so the pelvic cavity are bones, so it's like a basin, if you will. And if you think of this basin, this cavity, right, you're going to have three sets of organs that will reside in that. And if we're going front of the body to the back, you're going to have the urinary system. So the bladder resides within this cavity of the pelvis. And in the middle, you're going to have the uterus. And at the back, you're going to have the rectum, which is the very end of the gastrointestinal system. So the very end of the intestines is the rectum that actually resides in this cavity. So this pelvic floor grouping is supporting. So if my hands were to represent that ensemble of muscles, it's carrying these organs, making sure that they stay lifted, they stay supported, and that they're not coming down. And so this is one of the pelvic floor's primary function, is to support these organ systems. So that's more like a structural support. From a functional standpoint, it's because we're talking about these orifices, right? These holes, it either can close off these holes or allow these holes to open. And so if you're tightening or contracting your pelvic floor, you can allow anything to enter or exit these holes, right? So if we're talking about urine that's exiting the urinary system, the pelvic floor is going to allow urine to either exit or, well, nothing really enters there anyways. It's not supposed to, but if you don't want to pee your pants and your bladder is full, it will really close off the urethra, okay, which is the tube that allows the urine to exit through. And one can have things enter, have cystoscopies. If one had to go and have some sort of specialized assessment of the bladder, then sure, you can have a device of some sort enter there. But it's meant to, outside of medical reasons, it's only meant for exit of urine. And if we're talking about the reproductive system, so the vaginal canal is exit and entrance. So before you actually reach the orifice that we see from the outside, it has its own exit, right? And the vaginal canal is also termed birth canal because it's one of the primary reasons for having this. It's to allow for babies to exit for vaginal births, right? And hence why it's so pliable, because it allows for an actual human to exit. And that's supposed to, as the baby exits the vaginal canal, the baby will then bypass the pelvic floor. And for as far as intimacy, for intercourse, then you can have penetration or any out in if you're having any sort of exam. So like pelvic health assessments with me or seeing a gynecologist, just anything that requires having to insert something, this has to bypass the pelvic floor for that to happen. And last but not least, we talk about the rectum that ends in the orifice that is referred to as the anus. This is made for feces to exit. So the toxins, the fecal matter to exit the body through this channel. Things can enter, we're talking medically. You can have rectal exams that require entrance. And depending on who you ask, maybe for intimacy, there's some people that might engage in intercourse in different ways via that route, right? But the rectum is made for or exists for feces, okay, for fecal matter to exit. And then that matter has to then bypass the pelvic floor. So it's very important for that reason for the pelvic floor to be healthy and allow easy bypassing, whether it's entering or exiting. If it's too taut, then that can make things harder. That can make things painful. And if it's too loose in terms of things entering or exiting, sure, it would be easier, but functionally, the structural integrity of it would not be as efficient if the tone, the level of strength of the tissues are not firm enough.
I'm seeing it as like a rubber band. If you stretch your band too much, it's going to keep that stretch. It's going to snap at one point.
Exactly, right? Yeah. And if we go with that example, like you have a scrunchie in your hair, right? Like an elastic band. So when you get it and it's initial, like the initial use of it will have good tone. So you would only need to wrap that scrunchie or that elastic band around your ponytail twice. But as it loosens up, now you're going to have to maybe 3, 4, 5 times. The looser that it is, the less support you're going to have. And so you might just be like, oh, I need a new one. Yeah, exactly. You know what I mean?
Your own.
Yes, exactly. Unfortunately, you can't really just buy a new pelvic floor.
And so I really love the image of seeing it as a diaphragm. And so if you see it as a diaphragm, how does it connect to the breath? Because I know when I go to Jen for now, I think a few months I've been coming to you. I'm fallen in love with how you do things and how you speak and how you explain it. But there was a point when you went in, like you did an internal exam and you were asking me to breathe and seeing how my pelvic floor moved with my breath. So I'd love to hear how it actually connects with the breath, because it makes so much sense logically, but I'd love to understand it anatomically, functionally.
Yes. So if you think of, your abdomen, it is an enclosed space. It is closed 3-dimensionally. This is why we use core canister a lot, because the shape of this core is like a can, right? And the can, if you think about it 3-dimensionally, the entire 360 of it is coming from, so if we're going to go towards the front, then your abdominal cavity or your abdominal muscles come into play. If you now come to the back of that can, that 360, then you're going into the back. So the back and the abdominal muscles have this strong connection, okay, as far as the human body is concerned. The top of the can is your thoracic diaphragm. It is the main breathing muscle, or part of the main breathing muscles, right? It's huge on how it influences your core system, your core canister. Right? And the bottom of the can is the pelvic floor. So you've got top, bottom, front, and back, okay? In terms of breath, because it's an enclosed space. When you take a breath in, as far as the thoracic diaphragm is concerned, so I say thoracic diaphragm because we use the term diaphragm for other areas of the body. Pelvic floor, areas of the pelvic floor is one of them. But the thoracic diaphragm, the top of the can, when you take a breath in, you think about when you're taking breath in, the purpose of taking a breath in is so that you can primarily pull in oxygen from the atmosphere. And so when you do that, your lungs, okay, they have to swell, they have to open up, they have to make more room in order to allow that oxygen to permeate and take over your body, right? So you really want to expand those lungs, okay? So as you expand those lungs, now those lungs, they sit right up on top of this core canister. So the top of your core canister, this thoracic diaphragm, is the bottom, is the floor of your lungs. So when you then take this breath in and your lungs have to expand, in order to create those lungs to expand, that floor or that separation between your lungs and your abdominal canister now, that thoracic diaphragm has to come down in order to allow your lungs to have more volume and take in that oxygen. But by doing that, by coming down, it's going to influence the pelvic floor, which is the bottom of that core canister. It's going to then bring it down, right? So like a piston, it's going to come down. So you take breath in, great, it comes down, right? As you then release the air or allow the air to exit, right? Carbon dioxide has to leave your body with other toxic gases. Your lungs can then resume its original size. It doesn't have to be that large. So that thoracic diaphragm, this is your pelvic floor, then will come back up, right? So there's less pressure on your pelvic floor. And because the core canister is an enclosed space, when there is pressure coming down from the thoracic diaphragm, it will also put pressure everywhere else 360, right? It'll put pressure like everywhere. Some pressure will be dispersed to the front into the abdomen, some pressures to the sides, circumferentially into the back, and last but not least, into the pelvic floor, okay? And why for lack of a better word, the pelvic floor will take a hit a lot of the time is because the pelvic floor is very malleable. Okay, it's very pliable, just like the abdomen is. But because of this gravity-ridden environment and because of how we're upright positioned most of the day, it's going to take the brunt of the pressure. Okay, so it's going to come down on it. And breath, I'll often, like I asked with you, I'll say, take a breath because I want to see that if there's this organic movement that's happening. There is supposed to be that movement. It's always supposed to be working like this. Even if you're sleeping, you're taking breaths while you're sleeping. So that piston behavior is still supposed to happen. So it's to see, am I feeling movement in your pelvic floor, even at rest? So that is the synchronicity between breath and your pelvic floor.
Yeah. And something that you mentioned to me during one of our sessions was the container moves the contents. And so how we're structured and each one of us are so anatomically different in the way that we are positioned, and our favorable movements of our body will change our skeleton. And does that change how the breath meets the pelvic floor?
Yes, so it's definitely a combination of things, but certainly how one's body is positioned. So if you have twists in your body, will influence how the breath is dispersed in your abdominal space, okay, in this core canister, and hence what type of pressures, what loads your pelvic floor will have. And it may not be even throughout, which is why one wants to try to have as much neutrality, if you will, or just not have any asymmetries or minimize that in the body so that you can keep even pressures throughout your pelvic floor. So I always like to say it's all about the bones, because the skeleton being the pillar on which everything is attached in your body, directly or indirectly. So whether it's skin, organs, ligaments, fascia, all that stuff, right? But the skeleton, right? You can tell a lot by what that skeleton is doing. So if the skeleton of your body, your spine, your rib cage, your pelvis is on a twist, the structures that attach to it will also, you don't expect to just, okay, you do your thing, skeleton. You go on a twist, but you know what? I will stay neutral. No, it's going to drag things with it, right? And dragging things with it will then influence how diaphragm, that attaches to the skeleton as well, will then have to shape. It'll be a different shape. And so when you're breathing, then the breath and therefore the pressure will not translate to your pelvic floor in the same way. Okay. So taking these twists off, having optimal mobility in your joints. When we talk about joints, is where one bone connects to another. There has to be good mechanics, good movement at every joint
Hmm.
throughout
Yeah,
the
I
bone.
love it. I love the approach. I'll talk about my experience when I was
Mhm.
coming to you to see for the pelvic floor specialty. I thought we were just going to look at my pelvic floor, and then you're like, no,
Mhm.
at
Yeah.
everything. And
Yes.
then you started to work with my body. I was like, oh, this is incredible. This is a macro view. You're not just going in, you're going everywhere to make sure that everything is gliding, sliding, working so that the pelvic floor can have the function that it needs. And I was like, wow, she
Mhm.
gets it. She totally gets it.
Yeah.
So, speaking of the container moving the contents, in a pregnant woman after birth, I imagine that there's so much pressure that happens in the pelvic floor. Like, what are the most common changes or challenges in the pelvic floor hammock after a person has given birth?
Yes. Birth, certainly the type of birth can influence that as well. So if we're talking about cesarean versus vaginal delivery, if we're going with the vaginal delivery, the fact that your pelvic floor has to be stretched, I mean, it is stretched, I mean, even like 3 times its original resting state. So that in itself, the pelvic floor has to accommodate that stretch. And then with that, like it's expected to then recoil back to its original where it started. So it'll certainly impact the degree of stretch, but also can it recoil back to where it started? So with the vaginal delivery, there's that structural impact, if you will, versus a cesarean. It has its own right challenges as well. The body is so resilient. So no matter what type of birth you have, the body, it never ceases to like, how can I say it, to impress me with all the women that I see and what they've gone through. The body just manages to just stay tip top with all of that. But pregnancy in itself is a load. Okay, just carrying the baby in there will put a load on the pelvic floor. And if you think about a hammock, that is tissue, it's not just air, say, and even air has to support, has certain density to it, right? But if we're talking about the hammock that is supposed to support a person that is in it, right, you're lying this hammock, we enjoy lying in the hammock because it's supporting us, right? The individual is the lying in the hammock, it represents the organs, represents the baby that is added to that equation, and the hammock is our pelvic floor. If you are 2 people in the hammock all of a sudden, if you're 3 people, 4 people, right, what's going to happen to that hammock, right? The pelvic floor has to then somehow manage to not succumb to the amount of load that is happening, the added load. But that's what's going on. Not to mention that you've got the hormones that, just in a woman with estrogen, that estrogen is supposed to, it's a very positive, it does wonders for our body. But if we're talking about pregnancy specifically, you've got now the relaxin that is added to the equation. And as the title, the name suggests, relaxin, it's to relax the tissues. And so it'll loosen the tissues that much more. So if you're going to have that loosening of the tissue plus the load, then 1 + 1 = 2, right? So your pelvic floor is going to take more of that. It has more work to do. Okay. So don't get me wrong. Doesn't mean that, oh my God, we're doomed. Obviously, we're all here because some woman carried us, but it's not to negate the fact that the pelvic floor has to undergo a lot in order to withstand the pressures that come from pregnancy and a human actually passing through. So that's what it is as far as pregnancy is concerned and birth.
Okay. When I practice with a lot of women after pregnancy or even in perimenopause, they talk about incontinence. They're like, I can't jump because sometimes when I jump, a little pee comes out. How can someone prevent the pelvic floor from becoming too weak or too tense so that incontinence isn't just, oh, this is my life now, but it's something that we can take care of and it doesn't have to be this diagnosis that we carry with us for the rest of our lives.
Mhm. So it's multi-layered for sure. It's definitely not black and white. Pelvic floor is part of our bodies from the time we're born and it's building. You come out the womb, right? And your pelvic floor is already doing things for you from infancy. And as you grow and as you are going to stand on these legs, and even if you're not standing on your legs, you're doing daily tasks, your lifestyle is going to impact how your pelvic floor is going to respond. So you do want to expose your pelvic floor to stressors, one being exercise. And even if it's not regimented, this idea of necessarily going to the gym, but it's really just loading the pelvic floor because the pelvic floor will respond to what you give it. So if you don't expose it to stressors, and in this way, we're talking in a positive connotation, then it's not going to shape itself accordingly, structurally and functionally. And so when then your body goes through changes where it is more vulnerable, then you're going to start to have this dysfunction where all of a sudden dysfunction can then come in ways like urine leaks, right? I think of my kids, my daughter, since we're talking about women, right? Sports, exposing them to activities is important in youth, not just because of, sure, there's many things that we can get into as far as that's concerned, but if we're talking about what it does to the pelvic floor, as the pelvic floor is exposed to these stressors younger in life, right? It's already building, it's already preparing that pelvic floor so that when you're in your life, it needs to be there for you during pregnancy, for instance, and birth, and then postpartum recovery, then it's more resilient at that point, right? So it's been exposed to these loads from youth all the way up until these milestones that you're going to come across when as your body changes throughout your life phases, right? So the pelvic floor, we should be aware of that it's part of us at all times.
It absolutely makes sense that when we're younger, we have the chance to really build something resilient inside of us. And so it's important to introduce a relationship. If we come into challenge with it, what would you suggest to a woman that was suffering from incontinence or prolapse or something that has happened that's more challenging in the pelvic floor?
So it depends on the status of the pelvic floor at the time and what's creating the leaks, but certainly assessing at all times, whether it's a pregnant woman or not. Strength is one thing, but I use the word tone, like in the literature, it can be used differently. So tone oftentimes in the literature is akin to strength. I differentiate the two. So strength is the degree of contraction that your muscles has against a load, okay, against some sort of challenge. Whereas the tone for me is more about the pliability of the muscles, right? The degree of pliability. So it needs to have good tone, meaning that you shouldn't be able to stretch it for days. So I'm looking at that, the degree of the elasticity of the connective tissues there. So the muscles in combination with the fascia and everything that is the pelvic floor. But then we're also looking at the strength, okay? Because one can have very strong muscles, right? But then the elasticity is more supple, say. And so you look at the strength, you're like, okay, why is this woman having leaks? Your strength is there, right? We have to consider, yeah, okay, your degree of strength is good. It might be the rate at which you can, the speed of contraction, right? It could also be, again, the support system, that it's too elastic, right? And oftentimes I would say that's the most challenging thing for me and frustrating, actually, because it's like, how do you fix muscles that are too supple? Let's just say it's not the actual function of the muscles, meaning that it's very strong and the speed of contraction is there, but yet this woman still has leaks. So now we're talking about a ruling out process. So then I'm like, okay, then now we have to work on getting this tone back, right? And what we have in our toolbox right now is really the strength for one, or building the strength, okay, because it's the only thing that we've got, quite frankly. But it's also, now we're talking about other pressure management, okay? So pressure management comes from the way we breathe. It comes from the alignment in your skeleton. It comes from the integrity of the connective tissues. What is it actually made of? I can't see that clinically. It's like under a microscope, I don't know what it's made out of, but this is where now you have to talk about hydration as well, because the suppleness of the tissues come from hydration, and the integrity of the tissues themselves, what they're actually made of, has to do with what you eat. So we have to start talking about how are you actually nourishing your body. So these are all the things that, so it's that's why I say it's very colorful as opposed to a one straight answer. So one has to be with that individual, the context of that person's lifestyle and what their body is actually made of, literally. Yeah.
That's so interesting. It's like a global network working together to create function in this very important part of our body.
Yes.
And I'd love to speak about the other, and I'm sure it's a multi-layered answer as well, but the other side of it is painful sex. A lot of women rarely discuss, but very common, is painful sex. Like, are the most common causes, is it part of the same network, like the same ecosystem?
Yeah, so painful sex can be classically people might think like oftentimes when a woman comes in and they're having that experience, they automatically assume most of the time that they have a tight pelvic floor. But actually, a lot of the time, I don't see that in
Mm.
spite of one experience having that. So it can be that. And if it is a hypertonic pelvic floor, that is easy. Because if it's just purely about your structures being tight, okay, let's do things to loosen that, right? Stretch. You know what I mean? That's very what we call somatic. It's purely about the structures, right? But if you're experiencing pain and it has nothing to do, nothing, it's not purely somatic, it's not just structural, right? In that way, where it's not because your pelvic floor is tight, then we have to go into other things that can influence that type of response. Painful sex can be an emotional thing, right? It could be what your experience trauma. It could be, and there's a lot of things now that we're trying to, this is why research is ongoing too, because then if it's not necessarily trauma and it's not your structures, but yet you have sensitive tissues there, then where is it coming from? So one has to really have conversations with that individual to work together and see what works best and try different strategies to desensitize the tissues, right? And a lot of time painful sex, it's not even the pelvic floor level, it's at the vulva region. So you're not even at the pelvic floor, right? So even before you even get inside the vagina, you're already having pain there. And that is actually more commonly what we're seeing. It's not even at the pelvic floor muscles. It's really at the vulvar region, right? And on the inside of the labia, that tissue that is mucosal, the mucosal region of that tissue it's sensitive by nature because there's a lot of nerve endings there, but it tends to really affects women during sex, and this is why they have pain a lot of the time. So it's about using approaches that will make it less sensitive. And that is very much breath comes into that, how you stimulate it or to expose it to stimulations in a gradual way so that you're like training the nerves to be like, oh, yeah, you don't have to react to this soft cotton swab. This is a cotton swab. This is that mind body connection, right? That
Mm.
neural, the nerves, the brain, and the actual structures, the vulva itself, the tissues that are there. Say, okay, let's now expose you to this the sensation and see how you respond to that. And it's through graded exposure, right? So it's not doing anything. It's you have to train the nervous system to adapt to the touch that is now giving it a response that is outside of what it's supposed to be feeling, right? So that then becomes another facet of pelvic health for women who are experiencing pain with intercourse. One shouldn't have pain with intercourse. It is not normal, okay, to have pain with intercourse is supposed to be a pleasurable experience. And so if you're having pain with intercourse, then one deserves to have pleasure with intercourse. Otherwise, like, why have it? And if a woman is trying to conceive and they have pain, now it just becomes now you take enjoyment away from what is supposed to be an enjoyable experience in conceiving, right?
I
Yeah.
love you're like, yeah, you should absolutely flush first.
Yes. Yeah. So what's the point then? Like, so why put yourself to that? And then you're already like, oh God, now I have to have sex again. Oh my God.
Yeah.
And you have to like, and it's a vicious circle, right? Because if you know that pain is coming, you're going to guard. It's a protective because you're just anticipating it. And then you contract, and that creates more tension. And then it's literally a physical block barrier for having any sort of penetrative activity. So it's a vicious cycle. We have to break that loop.
Yeah. So you've already answered my next question. I was going into the emotional component of the pelvic floor, like how do stress, trauma, emotional patterns show up in the pelvic floor? And so you said it could tighten, it could create pain. Are there other ways it can show up in the body?
In terms of with the emotional experience?
Exactly.
Yeah. Yeah. So there's definitely pain. If we're talking about pelvic floor, I would say that it'll tend to be a painful response. Oh, and maybe you might have leaks also, not necessarily because of what I mentioned before, because the tissues are looser, say, but you can have it because it's too tight, right? So that it can be a cascade of events. Like for one person, it might be the exact same. What prompts tension in one person could be looking at the structures themselves, you might say, okay, you have tension, but for that person, what brought on that tension is completely different from what the other person, what brought on the tension for the next person. And this is why it's important to look at the context of what that person is experiencing. But yeah, leaks then can come from tension. It might not start off as leaks initially, but it might take, who knows, years for that to manifest itself. But I would say the common things that can occur are leaks, certainly pain. You can have prolapse. Prolapse can come from the lack of structural support, but can also come from tension as well, on pressure and how you're breathing, because then the breath, like just that core canister, if there's too much pressure from within that, that then can create a prolapse, which is really these organ systems that I talked about that reside in the pelvic cavity.
Yeah, people that breathe really high in their chest, that don't take that like big breath. I'm thinking about women with anxiety. They can have a lot of pelvic floor symptoms because of the anxiety that they're experiencing in their body.
Yes. And it's yes. And it's all about, they're supposed to, that piston has to happen. So that, yeah, up and down. So if it stays down, if there's no movement, it is staying at the same position, that the top of that core canister, then that over time will create pressure and therefore can result in tension in the pelvic floor, because the pelvic floor below now is like in constant state of having to support this pressure that your diaphragm is not, there's no movement there. And therefore your pelvic floor will take the brunt of that. It can create weakness, right? So it may not be that it's becoming hypertonic. In another woman, it might be for somebody who's not breathing efficiently and that diaphragm is like, there's not enough excursion, might have, it just gets tired over time, because it's like this pelvic floor at the bottom is like trying to be there for you, but over time it's like, I just can't. So then it can weaken as a result of that. Again, it's a very individual thing. And you see it from one person, it can go a certain way, and another a different way, for the same reason. Like your diaphragm is just not efficient in its excursion. It has to have enough play in it as well, right? So if it doesn't have enough excursion, the smaller that play, that up and down with that diaphragm, if you will, the more consequence, okay, or the more compensations have to happen in your body to adapt for that lack of movement there, or for the lack of breath as a result of that inefficient breath.
That's so interesting. So many examples are coming to mind of so many women that I know that have nervous system dysregulation, and they see something come up and they hold even more and they hold even more. And the problem becomes this feedback loop, this vicious cycle. And then they speak about their incontinence and how nervous they get if a teacher says, okay, now we're going to do jumping jacks. They freeze. Like it's almost creating a deeper vicious cycle in their body. And I never put that together. So that's such an eye opener of, okay, nervous system relaxation, breath is an even bigger contributor than I thought.
Yeah. And let's not even talk about, if we're talking about anxiety or just negative feelings that a woman can go through, a human, but in a woman in particular, there is also a chemical reaction with that, right? So it's hormonal, it's the neurotransmitters. Now, this is me getting really scientific-y, but really how the brain is supposed to, so how the brain is supposed to, all the chemical connections, right, happen because of what your body, what emotions you're experiencing. So it's not just a feeling. The feeling actually translates to the chemical response that your body, the cascade of chemical responses that your body will go through.
So like how you think about your vagina, your vulva, your pelvic floor is going to influence how it behaves.
It will influence how it behaves. But like from a chemical standpoint, like it's going to say, okay, if you're stressed, more cortisol then will be released. Okay. If you're anxious, the part of your brain, the limbic system, which is responsible, a huge part of the emotional part of your brain, will then release an actual chemicals and saying, okay, I'm stressed, I'm anxious. So let's release that hormone. Let's let that neurotransmitter, let all these chemicals in your body release based on how you are feeling, right? There's an actual chemical response that is happening. And that chemistry then influences how your body will say, okay, contract now. You need to contract now. Okay. Because this is the chemical reaction that your body is experiencing that is responsible for your muscles actually contracting. versus, so we don't see all those synapses or all those connections, but it's actually happening as well. So it's not just, oh, I'm anxious. Yes, I feel that, but there is a chemical hormones are being released. So there's an imbalance of hormones that are not optimal for your body at that particular time, that then manifests into what you're feeling physically and your pelvic floor as well.
Yeah, there was one session, I think it was the first session, that you were doing my internal and at the tissues of my labia. And oh, they're not as red as I wanted to be. And I was like, oh, it's because I'm in my luteal.
Yes.
So can you talk about that? Because that also
Yes.
blew my mind, how our color can change, our texture, our thickness can change
Yes.
throughout the month.
Yes. So what I will always do is I'll look at the vulva, right? So when you open up the labia, the tissues there are a rosy hue. Okay. They're supposed to be pinkish, right? So anything that is like lumen, any sort of canal cavity, right, in the body has this similar color, right? The mouth, the inside of the intestines, right? They all have this sort of color, and the color represents something. So in terms of how healthy it is, right? So I will look at the start of this cavity, this vaginal opening. I'll start by just looking at this mucosal lining, and I'll look at what is the color. So pink is great. If it's getting more rosy, like a darker rosy, great. It's very vascularized, meaning that there's a lot of circulation. It's very luscious. It's looking good. And this is a representation of, oh, in a woman especially, oh, this estrogen is on. Okay, it's doing some stuff for you. You know what I mean? When I see it getting more pale, then it's also telling me there's less circulation there. Okay, where are you in your cycle? You know what I mean? Women who are perimenopausal, menopause will tend to get closer to like a blanched state, become more pale. So the life of the tissues, I know it sounds but the life of the tissues, the vibrancy of it becomes dimmer. And that's not seeing as much of that rosy, that redness, right? Now it can be red, like inflammatory red. So that also you can see as well. And so you don't want that either, right? Because then that's painful. But it's certainly all this to say, looking at this area of the vulva called the vaginal vestibule, you can tell a lot or get a lot of information based on what the appearance of it, the color, right? So that's why I like to look at that. And it's just compare you to yourself, because everybody is different too. But it's just to say, okay, maybe today I saw this color, and then in 3 months from now, we're still seeing the same color. I'm not going to compare you necessarily to someone else. I'm going to compare you to yourself, but there is the norm of what tissue should look like in terms of color. You should have some rosiness. There's a spectrum. Exactly. Yeah. So I think it's very valuable for a woman to even know that about themselves. I can say wholeheartedly, there's no woman that I've seen that I've done that type of assessment with that was on the radar coming in prior. There's this, it's not standard for health professionals who are doing any sort of pelvic health or gynae check to really look at the color of the vaginal vestibule, because that can give you information.
Yeah, I've never heard that before. And I like to gaze at I like the term vaginal vestibule.
Yes. That's me.
Yeah, because I find the vulva so beautiful. It's interesting that the look of it, the shape of it, how it like curves and moves. And I've never even thought about looking at the color of it. I'm thinking about, is my labia the same? Is it thinner? Is it more mucousy? What's going on there? I've never really been like, oh, I noticed that this week it's a little bit more red than black. So it was really nice to be, I'm going to add that to my checklist of
yes.
Speaking of the tissues, can we talk about the thinning of the tissues as we age? Is that something you talk about with your clients, like in perimenopause, menopause, and maybe some suggestions as to how to keep the cervical fluid feeling nice and lush?
Yes. So I would say hydration for one is huge. When we're talking about the tissues themselves, biologically over time, there's so much about the body that we still don't understand and that we'll never understand. And I think that is good sometimes, because it's meant to protect us as a human species. If we knew everything, that's my personal opinion about it. If we knew everything that there is to know about the human body, then, we would do things to hinder. We would not leverage that information for good, okay? Or there are certain aspects of it that might not be leveraged for good. So I think a little bit of mystery is good, right? But all this to say that biologically, the body is going to go through phases in life where it is going to be at its prime, if you will, and then it will then change, like in its prime, meaning that for a woman, it all has to do with the degree of estrogen that your body is able to produce. Okay. And sometimes the body produces too much estrogen. So again, it's all in moderation, right? But the body is supposed to, the woman's body, it's all about that primary hormone, that estrogen, and the amount of it that's in your body. So if you have an ample amount of that, will deeply impact, influence how your tissues, your muscles, your fascia, all the things that make you structurally that much more stronger in terms of the tissues and more plump. And we're talking collagen. Collagen is one of them. It's a huge one because the estrogen, very much in the presence of it or the lack thereof, influences how collagen will behave. Okay, so the collagen, you want it, that elastic band analogy, right? So you want it to be firm, you want it to be feel like you can't stretch it for days, and you want that. But then at the same time, you don't want it to be, it's like this perfect like mix of it has to be firm, but not too, not too tight, right? You want it to be elastic and like supple, but not too elastic, right? So the estrogen balances out the degree of stretch and firmness that your tissues are supposed to have. So then over time, as you lose the estrogen, or the estrogen is it's not as present, it's lacking in the body naturally. Your body is not producing on its own as much. And so as a result of that, the thinning, the tone of it will be lacking, the elasticity might become stiff as a result of this estrogen not being as present in the body. So this is a huge impact for women who are going through their hormonal changes where estrogen is not as present. So you're going to get thinning of the tissues as a result of that. You might become drier because estrogen, as far as the lubrication, that will reduce because the cervical mucus is no longer the same. The follicles are not present, and that's where the estrogen is coming from. So when you don't have that in your ovaries anymore, then you're not going to produce that estrogen in your ovaries, which is the primary region, the most abundant production of estrogen in a woman's body. So it's not to say you have nothing, but it's the most abundant place. So when that is not happening anymore, then the cascade of events that your uterus is supposed to go through, including the cervical mucus, that no longer is occurring as well. The tissues, whether it's the tissues of the organ, okay, the uterus, and the tissues of your vaginal canal. Even the vagina is like, the vagina has walls, right? So I like to use the analogy of a cave, a tunnel, right? The walls are thick at some point, right? But then even the walls of this tunnel then start to thin because there's connective tissues in there, collagen being one of them, major, right? And so that will even thin out, right? The vulva, the tissues from the skin to the fascia, that everything there then starts to thin out. We're not doomed as we get older, okay? We're not doomed as we get older. It's just to know that because these changes will happen, what can one do? Hydration, nutrition, exercise. Because of this, you want to preserve the strength that you have in these tissues, right? But through exercise as well, it will then also promote circulation and the cascade of hormonal events that will happen through the exercise. Okay, it's not just about the strength of the structures, but it will actually promote more circulation as well. Okay, it will also promote removing or keeping the hormonal levels balanced. Okay, so you don't have so much bad hormones or bad chemicals floating around in your bloodstream. So if you exercise, then you'll find your bloodstream will have more, just better content in it, so that you can control through activity levels of being higher. So
I love that.
yeah,
I think it's so important as we age to have all these factors and understand how to, not necessarily a checklist, but just take care of ourselves in an ecosystem type of way, and not
yeah.
just, oh, we're getting older, we're doomed, our sex life is doomed. We got
No. Oh my gosh. Thank the Lord, because that would we'd be doomed otherwise.
Okay.
Yeah.
So speaking of this, I have one question, because as like a perimenopausal woman, the estrogen fluctuates quite a bit. It's some months are really high, some months can be low. And I guess it's a more individual basis. But I hear a lot about women putting estrogen cream on their vulva,
Vulva, yeah.
and around their vagina. What do you think about that? What is your opinion on the estrogen cream?
Yeah, so I think it's great. I think it's great if it helps you have a better quality of life. It's definitely a personal decision, but I've seen it really help a lot of women in terms of supporting you in your estrogen so that your structures can be more luscious and stronger. So it can help a lot of things. It can help with pain with intercourse. It can provide more lubrication, all the things that estrogen is supposed to do that once no longer as present, that based on what your goals are. So it's a very personal thing. Estrogen is very much, I'm like pro it. Obviously, one has to consider your medical history, but with the creams, it's very local, right? As opposed to, because it comes in different forms, right? You can take by mouth, which is more systemic, so it'll impact everything. But I think as far as having a safer application for it would be to apply it locally. And if it's about what your pelvic floor it needs, then apply it to the area of where the pelvic floor is, as opposed to taking something by mouth and impacting your entire system, where perhaps you might have adverse effects, because it's not just your pelvic floor that's going to be impacted by that, but everything else in your body is going to be. So I'm definitely not I'm definitely a proponent of hormonal therapy when it's impacting a woman's quality of life.
Thank you. And then speaking of putting products down there, a lot of people always ask me, like, should I be washing my vulva with soap? And my go-to answer is always no.
Mhm.
But I would love to defer to a specialist and ask a question.
The vulva, so it's about the soap getting in, affecting the chemical balance of the vagina, which is internal in the tunnel itself, right? So we're talking about that pH balance. The pH balance, a normal pH is it's supposed to be on the acidic side. So we're talking about 3.8 to 4.5. This is give or take. The acidic environment of the vagina is there for a reason. It's supposed to prevent infections and bacteria from going up there, and then just living in there, and then even like floating up towards your uterus and then infecting your uterus. And so the pH, the acidity of the vagina is very important to protect it, right? The acidic environment, the pH balance also, and there's a point to this in terms of the soap question, is also supposed to protect the microbiome that's there. There's healthy bacteria there, okay, that live on the surface of the vaginal walls. There's just armies in there just protecting the vagina, okay? And so they need to be fed the right things. You don't want to kill off these soldiers, right? There's good soldiers and there are enemies, okay? Back to the, that's what I look at it, right?
So I'm turning my vagina.
Maybe that's literally, right? So it's all surrounded, the entire lining, the wall of the vagina is like all this militants, the soldiers are there, this microbiome, they're there. I've got you, vagina. I've got you. Okay. Just you keep feeding me and the right things, and I'm gonna keep protecting you. Okay. You don't, then you're just gonna kill off these armies, right? And then it's like these invaders that can come in and be like, that's really what it is. And that's where infections come from. There you go. So the soap now, the pH balance. So the soap it's made out of, there's ingredients in it. So the ingredients have to be compatible with the chemistry of your vagina. If hypothetically the soap didn't affect the pH, if it had then okay, great, wash up in there. But generally, it's not. If you're going like over the counter, you're going to the pharmacy and stuff, typically it's not really compatible with the pH, right? So can kill off you want these soldiers to remain, it'll kill off these soldiers, right? So that's
anyone ever asked me this question? We got some soldiers.
Yes, we got some soldiers protecting. We've got you, girl. Yes, that's what it is, right? But yes, when you use these soaps and it has these ingredients that are now going to kill off these soldiers, then it affects your lusciousness. So you can become drier, you can become infected, all the things that, pH, the normal chemistry of your vagina is supposed to promote, right? So long story short, I wouldn't use soap up in there unless you knew that, or anything, whether it's a lubricant or what have you for intercourse, it has to be pH compatible. You shouldn't affect the chemistry of it, right? Soap, washing, water, right? If you're going to go up vaginally, but there's really no reason to go up there, really. You're supposed to the vulva. It's like just right at the orifice, and outside of that, you're not actually going internally. So that's what I would say. You're not going internally. You should be staying at the level of the vulva. If you're going to go into, it's water. Okay, water is neutral. So it doesn't make it more basic. It doesn't make it more acidic. It just keeps it where it's at. So if you're going to go up the vagina, your safest bet is with water. And if you're going to use something that is outside of water, where the ingredients are not purely neutral, like water is, then, or as neutral as water is, then I would stick to the vulva. I'd stick to the vulva with the soap, and that's what it is.
Okay.
Yeah.
I'm thinking about the pelvic floor and all the openings of the orifice. So like, what did you call the pee hole?
The urinary meatus.
The urinary meatus. I'm thinking
Yes.
about that. And as you put soap in it, is it possible, like you said, you could cause uterus infections if the soap goes up in the vagina? Can soap create UTIs? Is that a possibility of if it goes up?
It could.
Okay.
But it's more acidic. That area is more acidic. So it'll kill off, you know what I mean? But yes, absolutely. So all of these orifices, they have their natural environment. The rectum is the less acidic of all three. But yeah, you shouldn't have anything going up any soap-wise. You shouldn't, unless you knew that it was compatible with the natural chemistry. So the pH balance or the pH level of your vagina, or what the pH level is of your rectum, and what it is of your urinary meatus. All these tunnels have a certain environment that keeps them healthy. Yeah.
As we move up into the pelvic cavity and we have the uterus and the bladder and the rectum that sit all beside
Side
each
by
other,
side.
side by side. If one is infected, like how does it influence the surrounding regions?
So like positionally for structurally, fortunately, if one is affected, I mean, it depends on, I guess, depends on how one would define affected. We're talking about an infection. Thankfully, they have walls that will keep the infection to that organ and it won't go to the next. But if we're talking about structurally, certainly, because they're side by side, it's like a domino effect. So if positionally one has more pressure, just if you're constipated and your bowels are full, not empty, and your rectum is full, and that's increased pressure from the rectum. The rectum is behind the vagina, and that will then put pressure on the vagina. That vagina, depending on how much pressure is coming from the rectum, with that can cascade like a domino effect into the bladder. If your bladder is too full with urine, then that can put pressure on your vagina. And depending on how full it is, it can then put pressure. And then if you have like your bladder is full and then your rectum is full, wow, now we've got like these shifts. We've got these shifts happening in these three organ systems, where then the orientation or the positioning of these organ systems will shift and then affect how the pelvic floor responds to those shifts. Okay. So that's what it is. As far as the pelvic floor is concerned too, a common one when doing rectal exams too, because the pelvic floor directly can impact what we call the anal rectal angle. And it's really the area, the transition between the rectum, which is the end point of your intestines, and the anus, which is where the feces will exit, right? The pelvic floor, if it's too tight, can actually affect the angle of the rectum, like shift it differently. And the way it shifts it can impact the neighboring organ systems. So the vagina will then be impacted, and then this might impact bladder, right? Because they're so closely linked, impacting one organ system, it's very easy for it to then affect the others. And this is why it's good to assess all things. So you might be coming for urine leaks or something like that. One might think, oh, just bladder. But then, well, it's important to understand what is happening with your rectum, your gastrointestinal system, and what is happening with your reproductive system, because they're so close. Something else might be affecting why you have urine leaks. It might even be your bladder. It might be coming from something going on in the other systems. You know?
I remember talking about this with you also in one of our sessions, and I was like mind blown by the angle of the rectum. I was like,
yes,
check this out. I imagine that even when you're pooing, if it's not positioned properly, you spoke about this with me, how it can create you'll speak about it better, but how it can stop the
The
Food,
exit. Yeah.
the exit from coming out. Yeah.
Yeah, absolutely. Clinically, we measure the anal rectal angle. It's supposed to be like if we're looking at this knuckle here, right? Here at this knuckle here. So when putting the entire finger, is what we do in a rectal exam in clinic, we're going to put the entire index within the rectum. And then I want to see how much of a bend do I have at this knuckle. At this knuckle is where the pelvic floor will pretty much land. And so is the shape of your canal 90 degrees, which is what it's supposed to be at rest. Okay. So give or take 90 degrees, a little bit more, a little bit less. Okay. But we're looking for approximately 90 degrees. If it's more of a larger angle, so this is the rectum, feces is supposed to run out of that. When you poop, you want this to happen, okay? Because that allows for an easy exit pathway for feces to exit. So when you poop, it's supposed to do that, right? When you don't want to shit your pants, okay? You don't want to do that. This 90-degree resting angle is supposed to become more acute, okay? Because you really don't want, you want to reduce the ability for feces to exit that. So your pelvic floor will then create an angle that is a sharper angle than 90 degrees, right? So that is what we're looking at as far as the pelvic floor angle. We want to, or the, not the pelvic floor angle, the anal rectal angle, right? The anal rectal angle. And so when using things like squatty potty, it's supposed to then facilitate you having a more of this for feces to run out, just based on how your body's positioned with that raising your feet up. But yeah, so everything matters.
Yeah, it's so interesting. And then my last question, because we didn't talk about this beautiful thing sits before the uterus, is the cervix. Like talking about the vaginal, the pH system, and it's there for a reason, right? Because the cervix is the opening to the uterus. It's like that. So my question is about sex and sperm. And so the vagina is an entry point. Sperm goes in. And so how these soldiers, how do they allow for the entry versus say, no, you're not coming up in here because the cervix closed for business?
Okay, so the cervix really its role is to protect the internal environment of the uterus. Okay, so that's its role. Unless you need it to be open, so it'll open. It'll be wider at certain times, or not wider because that's dilation. It will the passageway, the cervical os, the passageway in that cervix will either be open or there'll be a lockdown. Okay, the lockdown. Or the passageway in the lockdown is influenced, first of all, by the cervical mucus, the mucus that is produced by the cervix itself. Okay. And so if you want something to bypass, and we're talking about sperm, semen, if you want this army, okay, these other soldiers to then do what they do, and what they do when their function is right to procreate, and that means that they have to be able to get into the uterus, then it would be nice for the cervix to have the passageway that is open. And hence, for that passageway to be open, the cervical mucus, the consistency of it has to be one that allows for semen, pro-semen. Yep, you can enter, okay? And we'll tend to see this during the follicular phase, ovulation. It'll be egg whitey, slippery, so it allows for those swimmers, those soldiers to like slip in properly. The luteal phase where it's not the time for this army to enter there. It'll become more clumpy, thicker. It will create a barricade for the swimmers to go in, okay? As far as the pH is concerned, these swimmers, okay, the semen, they are a basic, like they don't do well with acidic environments. They do well with basic environments. Matter of fact, it can, if your vagina is acidic, it can can become more basic. This is why it's good to wash after intercourse, right? But if you're having intercourse at a time where your pH is more acidic, then the swimmers their survival might be less efficient, let's just say. Biology has it so that we can optimize, so that when you're trying to conceive, say, during the follicular, going into your ovulation, which is prime, that your environment changes, your vaginal environment changes so that it can be sperm and not want to kill them off. But the estrogen that is present there is there to also create lubrication. The lactic acid and everything comes from the estrogen being present so that it can be luscious and help the sliding, if you will, of the conduct of these swimmers to go up. Vaginal pH will change based on what the goal is at that particular time. And that happens to do with, it just depends on your phase. Like you have to know what your phase is to know, take advantage of that.
So it's really phase.
Menstrual phase.
Yeah.
Yeah.
What I'm hearing is like in your follicular and your ovulation, it'll tend to go more basic. So the cervical mucus I heard it's like tubules, like vacuums that help the sperm come up. And then in the luteal, it'll be like, no, you're not allowed to come in here. And it'll be acidic so that the sperm will be killed off at the point of entry. Is that correct?
Okay, menstrual cycle, but I want to make sure I'm getting this information correct too. Menstrual phase, when you're actual bleeding, blood is basic. It's more basic. The bleeding is not, it tends to make the environment more basic when you're bleeding.
Sting.
Okay. Okay, so it tends so you can get infections and stuff like that. So you really want to stay hygienic in this phase.
Oh, I'm gonna ask another
Yeah.
question.
Yeah, go ahead.
But then tampons, like a lot of women put tampons up in their vagina. Can that cause a lot of infections during that time because of the cotton and the chemicals that are inside of the tampon?
It could, which is why you need to change that.
Yeah.
It can't be like have that there too long. You know what I mean? When it gets so soaked up and stuff, you can't have it just lingering there. It's like it's a cesspool for bacteria.
And for toxic shock, is that like the...
So, well, that's it. Exactly. No, but that's what it is, right? So it's just like your toxic shock is just the bacteria in there is like your microbe, like all these positive good soldiers, your microbiome is so shot at this point. And these invaders, right? This bacteria that you don't want, then start to take over and then will then create not only just stay locally, but it'll start to take over your entire system. Like the chemical reaction of all this also your body will start to have a response that is telling you that, oh, my body has been invaded by bacteria and infection. And so therefore your body will just start to respond to that. Almost it will start to shut down almost because all the normal chemical responses of your body are now impacted.
Yeah. Whoa. Okay. That's so interesting to learn that during your bleed, you're more basic. I never heard that before. That's really interesting. And then one last question about the cervix itself. So during our phases, does the cervix move?
During your phases, the cervix,
like during the bleed, it's lower and closed. And then closer to ovulation, it's higher and open. So it helps the transport. And a lot of people, they go feel for their cervix to see which phase they're in. Is that?
Yeah. So multi-layered there too. It's the support of also the uterus, the entire system itself, right? When you are in the follicular phase and ovulation, which is where you have the peak of estrogen in your body, the estrogen will create softening of tissues, okay, of connective tissues, okay, collagen included, right? It'll create that because what we call the cross-linking of fibers, okay? So it's almost every fiber of the tissue's collagen, they have hooks in them, if you will. And these hooks influence whether the tissues will be like more looser, softer, or whether it'll be tighter. When you have more estrogen in your body, these hooks, the cross-linking of these fibers from like one collagen fiber to the next, right, will then start to loosen. So in doing that, then it will change the shape of the cervix, but it will also change the positioning of the uterus itself, because what supports the uterus, you've got ligaments that support it. And these ligaments also will then soften. And if they soften, then the uterus becomes heavier and then it can then lie lower. So if I'm assessing a woman and depending on the phase they're in, I have to take into consideration that the positioning where I'm feeling the cervix, for one, will be different because the support is no longer the same, because there's this structural change in the actual tissues themselves are going to change because of where you are in your cycle, because of the hormones doing different things. I don't know if that answers the question. Yeah.
It definitely does. I didn't fully understand it in terms of how the collagen is affecting our fascia, our structures, our connective tissue, and how it's making it more pliable versus more closed. And so we can feel it more when it's closed, and when it's more open, maybe like pulled in a different direction.
Yeah, or even the positioning until like how low and how high it is, right?
Yeah.
The uterus, right, can drop and then be higher because the support system, like these branches or these ligaments that come off of it, are just not there. It's just more weight on them because they're more
Pressure system will bring the cervix lower.
Yes.
So actually
Yes.
the uterus that's controlling the cervical position.
Yes.
Okay.
Yes.
That's
Yes. The cervical position. The cervical position, because the entire uterus is a whole, the entire organ is actually influenced by that. The cervical position. Yes. Now, the actual opening, see the passage, the cervix itself, like the passage for where the sperm will enter, that passageway is influenced by the cervical mucus. Okay. Like, because whether it's actually becoming shorter and opening, because that's very similar to what dilation is, it's effacing. And so that's when it becomes shorter. And then it opens up that space through which the sperm goes into. That's the dilation. I'm not sure that happens. And I say I'm not sure. I don't think that happens outside of when you're not in labor. When you're not in labor. Okay. Because, when you're not in labor, so when you're not outside of being in labor, the actual shape of the cervix, right? So if it's a certain length, right? So for it to actually shorten, which is efface, when we're talking about for labor, and the dilation, because usually when the effacement for it to shorten, it usually goes hand in hand with the opening of the cervix. They work hand in hand. And unless you're actually in labor, that the actual shape of the cervix, that shouldn't change from my knowledge, because you need the hormone that is responsible for that taking place, that causes the contractions. You know what I mean? Like your oxytocin and all that stuff has to take place for that the cervix to actually make the prostaglandins. So all these labor hormones need to also be present for the cervix to actually change in its shape.
Yeah. That makes sense. I confused the word. I meant to say cervix, but then I said cervicals. But
no, but it's the same. No, but it's because
it makes so much sense, and it's so interesting to learn about that as well. To learn that it does change during labor. It's interesting that it gets shorter.
For sure. It gets shorter, and the term is effacement. In French, it's to thin out, become non-existent. So that's what's happening during labor. It needs to soften to allow for that change to happen. So this is where the prostaglandins, that hormone, is responsible for the softening. Because if it's not soft, then it's hard for it to actually change. If it's still firm, it won't budge in its shape, but it needs to thin out. Those are the two characteristics of seeing that there's progression happening in your labor, that it's advancing, it's moving somewhere. It's that the cervix is supposed to efface, get shorter, okay, and thin out eventually, but then also dilate to actually widen and create space enough for the baby to exit the uterus. So those are the two things, right? So if one or both are not happening, then that can delay or stall the labor progression from happening. So that would only happen, to my knowledge, when one is in labor, because you don't want that change to happen when you're not.
No. What a magical body we have.
It's crazy.
So incredible to learn.
Yeah,
it's just I just love this explanation of how the hormones can change the elasticity of our pelvic floor, of the tonus, so that organs can drop, organs can lift, like just everything, like the whole thing. And then in pregnancy, how it shortens and it's just incredible how our body morphs in conjunction, in support with our hormones, and our body understands that we have to release this now, we have to release that now, and we have all these phases that create all these changes. Like, my mind is,
and it's just why the menstrual cycle is so powerful, and understanding what is happening at different times then allows us to take ownership or be in control of what we need to be doing during those times, and not because what you're doing during your menstrual cycle is not necessarily, as far as activities or even intercourse or what have you, that decision-making process is based on having a deeper understanding of what phase you're in. Because it's not just about, oh, I'm in my follicular phase. What does that mean? What is your body going through there? If you're having, say, pain at one particular time, then it's good to know, okay, even if you tend to be somebody that has pain, right? but is it may pain at certain time cycles? And if just understanding that, then you can be in control. Okay, maybe I won't have it at this particular time, this particular phase of my menstrual cycle, because it tends to be a time in my menstrual cycle where I have pain. So maybe this time I won't do that particular type of activity, or maybe do a different style of intimacy during that time that would be less painful. And then the times where I don't have pain, okay, let's go at it. You know what I mean? Because now I know that's the time that I'm not going to have pain. Now all gloves are off. Okay, great. Now I'm ready. So it's understanding your body. The menstrual phases of the menstrual cycle all have meaning. There's a whole bunch of stuff going on during that time in a woman's body. Yeah.
I love it. Can you create a master class?
It's coming. It's
Um,
coming.
Speaking of which, how can people work with you? How can they find
Yes.
you?
Yes. Nouveau Physio is our women's health clinic. So for pelvic health specifically. So people can find us through that and come and see us in person. We do virtual as well, but if we need to see you in person, that's our brick and mortar. And you can certainly visit us. But then also what's coming and what I'm really excited about is Elle Santé. And Elle Santé is the pelvic health app made for women, which is there's a lot of apps out there, right? This is the time. Femtech, let's go. But this came about because of all the need that I've seen over the years in terms I've been like practicing for what I've been like almost 17 years. And I've half of that has been really about women's pelvic health. And there's just so much still lacking. And it's mind boggling in terms of the lack of awareness and the support to help you just even know how your body functions and what you can be doing based on whatever journey you're in, right? So this is really meant to provide resources, treatment, care plans through an app. So if you can't come and see us physically, does that mean that you can get help? Or if you can go and see someone physically, because maybe the next clinic that you need to go and see, or the next professional that you need to go and see is just not close to you. So this is going to allow you the opportunity to do that. It's going to be super comprehensive. It's to really bridge that gap between the women that we see and the professionals, right? So that if, say, I don't see you for 3 months, I see you at one time and the next time I'm going to see you, okay, what are you doing in that 3 months? Does it mean, oh, the only time that you should really be aware of your pelvic floor and doing the things are in our sessions? No, like your pelvic floor is an evolving, continuous, for as long as you're alive, your pelvic floor is going to be doing things. Your pelvic health will be doing things, right? And so you should be on and aware of what's happening with your pelvic floor throughout all the days of your life, really. And so this app is going to provide, so we talked about master class. As I say, it's coming because we'll have courses on that to do just this type of thing and give you all the tools. And we're really excited about what's coming. And we're going to basically leave it in the hands of the women that are going through these experiences, because it's going to be made by myself and my team, my brother being the lead software engineer, but it's really everything that we're putting into it. It's from the women that experience it. I'm looking forward to that. We already have our prototype we're going to be trialing it in clinic this month, January, actually. Yes. So the first version is going to be released in our clinic internally. So that way we can see what the bugs are like. It's very much the very start of it. And then, but soon to come by February for sure, then we're going to release it so for more people to test and try. And then from there, before we add on all the bells and whistles that is lacking in our women's health community. Yeah.
I love it. We need it. And it's
Yeah.
going to fill such a gap for so many women. And
Yeah.
from the first moment that I met you, it was just this comfort, this ease. You've taught me so much in the sessions that I've been with you. So excited for women to have access to this knowledge, and
Excited to share it.
yeah, but I want to say that the way that you approach it is so different from any other person that in this field that I've ever met. And so I'm so appreciative of your work, and I can't wait to use this app and be a part of the women that will ask the questions to help shapeshift.
Oh my gosh, I'm so excited. I'm so excited. And I'm so thankful for you and having this platform too, because it's what allows for this awareness and for me to be able to share this information. So I'm really thankful for what it is that you do. And I have to say, in working with you too, you're super, the level of body connection and awareness. I told you this, you're like top in the women and I've seen a lot, like top 5 hands down. I can't even, it's just, yeah. Yeah, you felt that? Wow. Okay. You're like hyper connected, hyper
Mhm.
sensitive in terms of what's going on. So it's quite something.
It's my mission. I want women to be more embodied, understand that they can feel all the things in their body and not be scared of just feeling the soma of their body and knowing that all of the answers are within them.
Yes.
For specialized answers, go see professionals.
Yes. Definitely.
Yeah.
Definitely.
Thank you for
Yes.
saying that's really sweet.
Yes. Yes.
Oh,
Yes. I will say check out ellesante.com. That's where you
mhm.
can find information for the app. You can also find it on our website on Nouveau Physio though. So I'm like, now I'm just throwing all
Yeah,
the things.
yeah, just everyone should see you. Everyone should see
Yes.
your system. So let's promote the hell out of it. Let's get
Yes. Yes. And there's already more talk in terms of, I love what I'm hearing in terms of this revolution almost of pelvic health, women's pelvic health. Like now we're starting to have a little bit more conversation about it. And I'm looking forward to what this year is going to bring and just to be part of that. It's exciting. Yeah.
Yeah, I'm excited to hear what's to come.
Yes.
Thank you so much for having this conversation with me. It
Thanks for
was
having me.
tremendous, and I will see you soon.
I will see you soon. Bye. Bye.
If something in this episode landed for you, I'd love to hear what it was. You can leave a note or share it with someone you feel it might support. And if there's a question or a curiosity you want me to explore next, I'm always listening. Thank you so much for being with me. I'll meet you in the next episode.